Welcome to Social Work Talks. My name is Greg Wright. The mental health of our students has been suffering lately. So we're having a conversation with a Kimberly Matias, who is a social worker in schools, and also a Gary Pettengell, who is the CEO and founder of ECINS, about a new report on the state of mental health of school students. So, welcome to Social Work Talks podcast, Kimberly and Gary.
Thank you.
Hi. Thank you.
Yeah. So, before we launch this, I wanted to get an idea of who you are, Kimberly. If you could give us a description of how you actually started out as a social worker, and also where are you, and then after that, if we could talk to Gary a bit about ESON and its work.
Perfect. Sure. So my name is Kimberly Matias. I'm a licensed clinical social worker in the state of Rhode Island. My journey in school social work, in the school social work field, began in 2016. I was a mentor for at-risk youth and as well as a behavior specialist in an inpatient unit in Rhode Island. In between that time, I also volunteered as a therapist for undocumented and uninsured adults and also worked as a hospital social worker for some time. In 2019, I started my journey in school social work and have been a part of Providence Public School District for a little over 2 years now. I'm currently a certified youth mental health first aid trainer and have advanced training in CBT, motivational interviewing, DBT, family therapy, solution focused interventions, and trauma informed care.
Wow, a lot, Gary.
Gary, I'm the CEO at ECINS. We've been sort of doing our field of work. So it's getting towards a quarter of a century now, 25 years. We operate in the US, in the UK, and Australia. Primarily in the US, we're focusing on student support and case management. And so we're pleased to say, with the School Social Work Association of America, we're the only one endorsed by them in that field. And we're helping them to achieve their goal of trying to standardize best practice of school social work across America.
Yes, so there's a new survey out, and it's entitled "The State of Mental Health." Correct, or is it a longer title? Tell me that.
Yeah, no, that would be the title. Yeah.
Yeah, so I was wondering exactly what was a motivation for this survey.
It was trying to get an understanding of the true extent of the problem. And there's a lot of, as I'm sure everybody knows, that there's a lot of facts and figures out there. So it wasn't really a case of reinventing the wheel. We just really wanted to reach out to school social workers and counsellors and professionals in the field to really get an idea of, their understanding, their working, on the ground, and their perceptions and that understanding of the issue.
Yeah, so the findings were that over 80% of the students are saying that their mental health worsened lately. I was wondering at all if you were surprised by that finding.
It's always a shock, and it is surprising when you read it. I think the real value for us from the survey, it was, and for us as an organisation, it was actually hearing it, or firsthand from a large number of professionals. Yeah.
Yeah, so exactly how large was a survey size? How many schools or social workers were actually contacted for this?
Yeah, so it was towards 400, which was it's a reasonable, and it was a good spread across all the states in the US. So we were pleased with that, the spread and the number.
Kimberly, you are a social worker. You're out there on the front lines. What are you seeing? Is the situation a lot worse?
Yes.
Exactly what's up?
So I started school social work in schools in January 2019, as I had stated before. And that was just a couple of months right before the pandemic kind of took over and everything kind of shut down. And it was hard for me trying to figure out in that moment how I was supposed to be at home with my children and also try to support over 800 students in my school, which I was the only school social worker at the time, and be effective at my job, especially at a time where COVID-19 brought so much anxiety and so much fear around this virus. The amount of like grief and loss, as well as the increase in depression and anxiety and abuse and suicide risk, was very draining. Children finished one year virtually, and they started the next as well virtually. So it was very stressful and confusing, and just a really hard time for everyone. I think everybody was feeling it. Teachers, staff, everyone alike was just trying to figure out how to be in the moment of so much confusion and uncertainty. But once school were allowed to open again, many had hopes that things would just go back to normal. And unfortunately, that has not been the case. So the number of student social work referrals had more than tripled within the first month of us returning to school. And since then, fast forward to today, it's been about maybe 3 years since the pandemic started or so. And we're still trying to get through those referrals and still trying to make sure we see our students and that we check in. There's been such an increase in mental health services in crisis in our school and everywhere in general, but it's really hard to catch up on those referrals. And I've noticed new students struggling with things they never struggled before, right? Like so many students lost family members. They have some type of trauma. For many students, school is a safe space, and they were home stuck for so long without that safe space. Or some students I know, I can say from experience, like school would be the place they would come eat, and we were forced to not have that anymore. So all that was kind of just taken away, and now they return, and we're seeing so many increases in just things that we hadn't seen before, or that were not so intense, I would say. And
Yeah.
mhm.
So I was like wondering, what are those like things that you like haven't seen before that are now more evident
So
as far as the mental health of
yeah,
students?
so for me, I think social anxiety is one of the really big ones. The kids being separated from being in person with so many people. Like I can speak for a lot of our fifth graders that went on to middle school, and now they were supposed to have 6 different classes and all this stuff happening. And all around in general, like social anxiety has been one of the biggest increases we've seen. Again, grief, suicide risk, the abuse and things that kids were exposed to, and families having loss of income, PTSD, trauma all around in general. Not that it wasn't a thing before, but it has definitely increased in size since COVID happened.
Yeah. So you are the only like social worker for 800 students. Is like that right?
Yes.
Because yeah, that's like interesting because our standards for school social work actually call for at least one per 250. So that's
Yeah.
a staffing shortage
Yeah.
there.
Yeah.
That's a big
So
one.
we've
A lot of
we've
folks.
we've noticed the shortage, and like they pull us in different directions sometimes in the district to go cover at different schools because we just don't have it. And I think there's a lot of things that come into play as to why there's so little social workers available or in the field in schools. But for sure, we're trying to pass the bill in Rhode Island right now. Today is actually, they're at the courthouse trying to get the bill passed so that we do have 250, one social worker for every 250 students, which would make our lives so much easier. It's still a lot of students, but we're hoping that gets passed because it's just such a disadvantage for our students, and for us, the burnout is so huge. So we're hoping that that does get passed, and that the importance of having school social workers or social workers in general and mental health gets seen, and the demand is there. So we're hoping that maybe the wage increases or whatever properly that they have to do to make sure that these jobs are taken and that we can retain the social workers, because it's great that we can have one for every 250, but other job positions actually being filled due to that lack of resources or the lack of pay or whatever the case may be, that why those jobs are not getting filled.
Gary, ECINS, you have a mission to actually use data in order to like solve issues like this. So I was wondering, after looking at the like survey, what are some solutions to all of this? I mean, there's a shortage of social workers. There's a demand that's just like extraordinary. So I was wondering if there was any like hope that ECINS offered to all of this.
Yeah, there's a couple of avenues really. I mean, yeah, the data there is important, but I think it's also enabling that collaborative working. So there is a number of support mechanisms within the school. So you've got school social workers, you've got counsellors, you've got psychologists, you've got a number of people. So we our aim is to enable them to work effectively together. And again, to gather that evidence and that data in order to, as I take Kimberly's point, if we can do this with one school social worker, imagine what we could do if we had two or three, and it goes on. So it's enabling that everyone to work together to capture that data.
Yeah, so another thing is that I think that the survey had like said that a solution might actually be our technology. So how can our technology like help when there's a manpower shortage going on too?
I think it's streamlining processes. It's automated processes. It's reducing the administrative burden, and I think it's pretty well established. If you're trying to do all this on paper and spreadsheets, it's very, very, very difficult. It's time consuming. Even things of a student being referred in. If it's on a post-it note, if it's a conversation in the corridor, or if it's an email coming in from parents or guardians. If you can even make that an electronic process that sends out, it automatically updates, it sends notifications, that saves a huge amount of time. And that's just one element of identifying the student, and then the work with the student when you can make that more efficient as well. And so that's really how it can help. So it's overworked people like Kimberly here. It's enabling to support more students and work more effectively.
Yeah, so you and Kimberly have actually worked with each other before. I would like to know exactly what was that like project. How did that turn out?
Well, so we provide the system into Kimberly's school district. I mean, we've met lots of times on Teams in meetings, and we met at the SWA conference in Denver, and those old-fashioned face-to-face meetings, which was nice. But Kimberly's a user of ECINS.
Gotcha. How has it worked out for you though, Kimberly? I mean, has it made it like easier? I mean, I know that you want another social worker in there, like helping, but has it been a benefit having a bit of technology helping you
Yeah,
too?
so I can speak as we are a charter school, even though I am a part of the Providence School District. So I had we had been brainstorming last year as to how we could make our process more streamlined. So I think what we were looking for was a way to get rid of paper files, because the storage was becoming a problem. There's a timeline when it comes to how long we need to keep files and all the above. So that was an issue. And also, like Gary had said, just being able to communicate with everyone else on the team. So we have a student support team, which consists of administrators, counselors, psychologists, all the above, the mental health kind of team in the school. And as referrals come in, we were using, a user-friendly system that was out there already, but there was a lot of issues around confidentiality, and again, data pulling and being able to kind of just make a streamlined process so that we could all see when a student was referred, take ownership of that referral, whether it was, put in our notes and privately. We all wanted to be able to enter confidential notes, but also be able to see, hey, so-and-so was working on seeing the student already, or they were seen yesterday. So that one then doesn't become the top priority, right? Because we know they got some attention. And I think with the lack of the technology, we were having a really hard time trying to communicate those things. So students were either not getting seen or seen twice by different people, or, just it was becoming very confusing. When we approached ECINS, it was because we definitely wanted something to streamline our process. And it's been very helpful. Like Gary said, we've been jumping on Zoom calls here and there and just trying to figure out, hey, like this is working. What can we do for this? And ECIN's been great in that sense of, being able to tailor that system specifically towards everything that we need. And making our jobs just easier in that sense. Yes, we still have only, now we have 2 social workers, but, it's still only 2 for 800 students, but at least the counselors are also pitching in, and we can all kind of know, hey, you saw the student for this, and I saw the student for this. Now we know there's 2 problems. So when we go into our meetings, we can bring all this data and also send things to students and families from this system, which has been a game changer in general when it comes to school social work.
Gary, is ECIN only working with school social workers, or is it a system that also applies to other areas of social work? Social work is a diverse thing. There are veterans, social workers, school ones, private practice. I mean, it's over a lot of different areas. So is ECINS in more than just say a school setting?
Yes, it is. Yeah, so we can work in any setting. So whether it's from family issues, could be domestic abuse issues, homelessness, really, and we've got a number of projects across the US. So it's not just for social workers and counsellors, but it does work in other settings as well.
Kimberly, so our our pandemic is easing. So I was wondering, at this point, are you more hopeful that the mental health of our students over time will improve? I mean, are you seeing that, or is there a reason for a lot more concern
Yeah.
going forward?
So we've definitely seen the referrals kind of drop this year a little bit, which has been great. I think families are being able to go back to work and do these kind of go back into routine as best as they could. I don't see it going back to baseline pre-pandemic anytime soon. There's just so many after effects of the pandemic that we still need to address and kind of come to acceptance with when it comes to our students and families. So definitely feel like it's getting better, but still so much work to be done in the area.
Yeah, so I've actually read that our schools socialize our children, being around others socializes them, and that a lot of kids being isolated for a few years have actually missed out on that, and it's really made them a whole lot less of a mature person. And I was wondering, are you seeing that
Yes, for
at all?
sure. We're also seeing the increase in behaviors, and I think it has to do with a lot of it has to do with the fact that they were not given class instruction for face to face for so long, and so teachers were just trying to figure out how they can provide work, right? But then they came back to school a whole other grade different, and teachers start planning for that year and teaching things, and a lot of these students were like, whoa, like I'm not there, right? And so that easing back pretty much didn't happen. They were just thrown back in. And I think that now the increase in behaviors is because students don't really get the work, or they're not understanding it because, so to speak, they missed a very important year. So I definitely feel like that is huge, and it has been, we have seen that a lot in the school.
Okay, then. Well, for a final question, I'm wondering whether either of you has a closing thought at all.
You want me to go first?
Yeah, ladies.
That's a great question. So I feel hopeful. I think that, there's a lot more awareness on mental health now since the pandemic. So many grants that I've seen that are being provided now to help students with mental health services and all other mental health agencies and things of that sort. I think the importance of integrating behavioral health has been huge in the last few years. So I'm very hopeful. I think what I would want is for the stigma to continue to decrease around mental health. There's always this stigma of, people scared to or afraid or maybe embarrassed to even, say, hey, something's wrong with me and I should seek that help. So I'm hoping with time, and now that mental health is being so put out there, that people feel less ashamed to seek help, and that we can in that way reduce the instances of suicide and homicide and things of that sort, because it's so important, right? We talk about going every year to get a physical to check our bodies or blood work, but our brains are, if not more important, right? Because if we're not feeling okay, if our mental health is not okay, how are we supposed to feel good in any other aspect in life? So I feel the day that we begin to push mental health just as we push a yearly physical, that day we will be much better off when it comes to mental health in general. I think it's so important. And I feel like, for a long time it's been hidden, or people have been signaled out as crazy anytime they say something's wrong with me or I'm depressed or something. And people are just like, you're fine, get over it, right? But this is real, and we live through this, and mental health is so important, and it's so real. And I think we're getting better, and I'm hopeful for it. And we have a long way to go, but with everything that's happening right now, I feel like it has come to a streamline, and we're focusing more on it. And that is all that we could really ask for right now.
Gary, in your closing thoughts, I was wondering if you're like hopeful that our technology might help us here. I mean, is there a way to marry our minds with our technology? Because a lot of folks are looking at AI as like a threat, our technology, but you're saying that it might offer solutions here.
Yeah, I think on Kimberly's point, I mean, I think that mental health is definitely being spoken about more. I mean, I'm in meetings day in, day out with certainly with school districts, and it's encouraging that it's taken so seriously. They're talking about it. I mean, we've done some work around mental health screening tools, self assessments, and taking on. I mean, the figures show that students are like significantly more likely to fill in an electronic assessment where they can do it on their phones, on a tablet, as opposed to paper. It makes it easier. So and then it's taking that data to look at what works, what isn't working. And I think that's the thing. So it's providing the technology so more students can be supported, and the school social workers, for example, to make their life easier to provide that support, and then looking at that data and really taking on like the school's Rebecca Oliver's vision from SWA is to then promote that best practice. But in order to do that, the data helps in order to go, look, we've been doing this, and this is providing a positive student journey mapping. Well, let's replicate that in as many districts as we can.
Thank you. Kimberly, Gary, thank you for being our guest on Social Work Talks, and I hope to hear from you in future. Gary has actually done a column for us, so if you want to do more, holler. All right, we will welcome that.